Hello, welcome to a new episode of Healthcare Simplified. This is your host, Dr. Nandini Sahasrabuddhe. There are some diseases which may not be life threatening but severely affect quality of life. Today, we are going to discuss such a health condition that created quite a stir at the recent Oscars. Remember this? Chris Rock cracked a joke about Jada Pinkett's baldness, and everyone knows what followed, right? Yes, I'm talking about alopecia areata, which is also known as patchy baldness. Today we'll try to understand what alopecia areata is, what causes it, and what are the treatment options available for the same. Basically, alopecia is just a medical term for hair loss from scalp or body. Before we get into the details, let's back up a little bit and understand how our hair grows. If we cut through our hair and skin below, this is how it will look. There are different layers of skin, as you can see, and our hair grows through it, right? The picture here shows structure of our hair. This is the pouch, which we normally refer as root, and this is a tiny bump or anchor in our skin on which this whole structure is built. This bump also gives nourishment to the growing hair. It houses these blood vessels which are going to pass on food for growing hair. This phase, this is active growth phase of hair, and most of our hair, about 90% of our hair, are in an active phase of growth. The second phase, which is shown here, is how here in this phase the follicle or the pouch around the hair, it starts to shrink, as you can see here. In this stage there are relatively pretty small number of hair, about 2% of hair are in this stage. And then we have a stage where the pouch detaches from this anchor. As it detaches, of course the food source is lost, right? It is cut off. Without food, the hair dies and it falls out of the pouch. The pouch goes in a resting stage, and we have about 8 to 10% which are in this stage usually. After a while, usually it will resume to active growth phase, which was here, which we saw here, right? So what happens in this patchy baldness or alopecia areata? What happens is this actively growing hair are attacked by our own immune system. It it launches hair prematurely in the stage where hair pouch shrinks and hair fall. As the pouch is damaged by immune system, it cannot resume the active hair growth phase like it normally would, which you saw in this earlier slide, right? So that's how there are these bald patches that are created. Normally, alopecia or baldness, which is, like I said, alopecia is a medical term for baldness. It is classified in three ways broadly. You can ignore the medical terms which are written here. Basically, what they mean is areata is patchy baldness. Totalis is where the whole scalp is involved. So there is no growth on entire scalp. And universalis is where the whole body is involved. So there is no growth of hair on the entire body. Of course, universalis is a relatively uncommon situation. Um, Alopecia areata affects about 2% of the population. Though this 2% might look really small, if you consider the whole population, it's a pretty big number. I'm quite sure all of us know at least one or the other person who suffers from this patchy baldness. Historically, several causes like infection, chemical poisoning, thyroid disease, etc., were proposed as causes. But by 1950s, people came to realize that it was our own immune system that was at fault, unfortunately. And it doesn't come alone usually. It occurs with several other diseases like depression, anxiety, and there are other autoimmune diseases as well. Like I said, it is triggered by our own immunity. So if there are other diseases that are caused by this, our immune system going wrong, there are these other diseases that can co-occur, that can happen at the same time as this patchy baldness. The quality of life, I mentioned about that some time back, and one can imagine if this patchy baldness is developed in people, it is going to affect their mental health. Many people do require help uh, maintaining mental health when they go through this phase. The good part probably about this is 34 to 50% of the patients recover spontaneously within 1 year. So that's on a brighter side. What are the treatment options available for this patchy baldness? Currently, there are no FDA or European medical agency approved treatments for patchy baldness. Then how are the patients managed currently, right? So uh, as one can logically derive, as this is an autoimmune disease, which means our own immune system causes it, it becomes active at a wrong place, right? So we need a way to suppress that. So the first one that you see here, which is called as local or systemic corticosteroids, you don't really have to think or worry about what those really mean. Those are really ways to suppress immune system. Local is where it is given at the site where that bald patch is, and systemic is which is given in body. Then the other way patients are managed is contact immunotherapy. So what happens here is there is a competition that is built. So again, going back to what I said, this is an this is a disease which is caused by our immune system going wrong. So if we can distract that immune system by something else, so if we can create a situation by which this immune system gets distracted, right? And from this hair root which it was attacking, if we can distract and take it somewhere else, so um, and by that we can rescue that site which is affected by this immune system. So that is contact immunotherapy. Then there are other immunosuppressants that are used, which are which lower the immune response. Then there are also other non-medical ways of managing patients, with one of which is laser treatment. And like I said, many patients do require uh, mental health help because it's not a easy situation to deal with. It affects quality of life severely. Um, yeah, and what is seen on a brighter side is we are making headway into drugs that are specific and effective. So again, what is the rationale? I keep going back to the same thing. Like I said, this is immune system working in a wrong fashion, right? So people have tried to understand what are the specific uh, pathways, or what are the specific targets in this wrong immune response, and one of which came up quite in a logical way is a drug which is used in arthritis. Arthritis is again another disease which is caused by our own immune system. Our immune system works against us in arthritis, rheumatoid arthritis, and this drug baricitinib, sorry, is actually used in rheumatoid arthritis. Not long ago, a month back, phase 3 trial showed that 1 in 3 patients with patchy baldness were able to regrow hair after treatment with this drug, which is very, very encouraging. And this could be one of the earliest drug that makes way to FDA. These trials have been ongoing for quite some time, and there seems to be some hope on this line of treatment. Uh, other other directions in which we need to also work is we need to understand the disease better. Are there some specific risk factors for this alopecia areata? There are speculations, there is sporadic data, but not concrete. So, if we are able to identify risk factors, what is known is if parents have this alopecia areata, which is patchy baldness, children do have very high probability of developing it during their lifetime. But we need, I think, more studies and concrete studies to identify risk factors for this disease. What is definitely not clearly known until now is what really causes this immune system to go crazy, right? Why our immune system attacks our happy healthy hair which are growing nicely, right? So it is odd. We don't know what really triggers that, and we need to understand that. And are there ways to detect such triggers early? We need to also understand that. So, a lot of scientists all over the world are working on all these directions, finding drugs, understanding the disease better, and definitely there seems to be some hope on better management of this disease. I hope I was able to give some meaningful information in a concise fashion about this disease, which recently got uh, popularity for unfortunate reasons. Uh, but anyway, yeah. So if you found value in this video, do hit the like button, comment if you have any feedback, share it with your friends, and don't forget to subscribe to the channel. Thank you, and see you again.